GTPAL is used to better understand a woman's obstetric history. When recording the obstetric history of your patient, it's important to know what each term stands for. G is for gravida, which is the total number of pregnancies.
T is for term, the number of pregnancies that ended at term, at or beyond 38 weeks of gestation. P is preterm, the number of pregnancies that ended after 20 weeks and before the end of 37 weeks gestation.
A is for abortions, the number of pregnancies that ended before 20 weeks gestation. L is for living, the number of children delivered who are alive when the history was taken.
So you're going to see these throughout our video. This is the electronic fetal heart rate monitor. An external transducer is placed on the maternal abdomen and held in place by an elastic belt and girdle. For example, this is a decrease or loss of the fetal heart rate variability. So on the bottom, you're going to see the mother's contraction, and then on the top, you'll see the baby's heart rate dip a bit.
This is a 32-year-old female. She's 34 weeks pregnant with a history of drug and alcohol abuse.
Hi, Mrs. A.
Oh, hello.
All right, it looks like your baby here is having a slight decrease in heart rate.
What?
From its baseline. Yeah, so how are you feeling?
It's baseline.
Baseline, it's his normal stats, so it just seems like it's quite a big jump. So we're going to try and figure out why. Nurse Carrie, do you know why?
Are you on any new drugs or medications?
No.
Have you had any surgeries lately?
No, not since I had this bad boy in me.
All right. Have you been using any drugs, any stimulants, or?
Well, why would you ask that? I mean, over the past 6 months I've been using a little cocaine,
Oh, really?
Well, I thought it would help the baby's heart rate.
How often are you using cocaine?
Oh, like 3-4 times a week. There's not a problem there. I heard it helps the baby.
So there is a slight problem there. It will decrease your baby's heart rate.
That's bullshit.
It is.
That's ridiculous.
Yes, but it's not healthy
here
for
comes
your
one.
baby.
Oh!
So Nurse Carrie, what can we do to help her?
We're gonna stimulate.
Gotta get out!
We're gonna stimulate the baby's scalp. We're gonna connect the scalp electrode.
What?
And we're gonna position the client in a left lateral position.
All right, we're gonna move you to your left side. All right?
Okay.
That's left. Your other's left.
Oh, this will help you with your pain.
How's that?
Yes!
Okay, early decelerations are caused by head compression. They are also called mirror images of the contraction because as the contraction starts to rise, the heart rate will drop. And as the contraction starts to fall, the heart rate increases. So if you were to cover up the contraction and the deceleration at the same time, you wouldn't even see the deceleration. It occurs at the same time as the contraction. So early decelerations are a normal type of deceleration. It is a sign that the mother is probably progressing well in labor and needs to have her cervix examined, as it may be time for her to start pushing.
This is a 16-year-old female. She's 41 weeks pregnant. She's healthy with no prior surgical or medical problems.
Hi, Mrs. B. How are you today?
Hi, I'm okay.
Oh, okay. Congratulations on the baby.
Yeah, I'm a little young, but these things happen.
It happens. All right. So we noticed that you're having what we call early deceleration, which is every time you start to have a contraction, your baby's heart rate dips a bit, but then it goes back to normal towards the end of it.
Well, what causes something like that to happen?
This can be caused by the umbilical cord being in an imperative position. It could be maybe around the baby's head or neck.
No.
I'm just going to run a quick ultrasound and make sure that's not the issue.
Oh, please do.
All right.
You might be also having
Oh,
some
I'm having a
fundal
contraction
pressure.
right now. Oh.
So see how that dips a bit right there? Yeah.
Oh, here it comes. Ooh.
And then see, now it's back to normal.
Yep.
Yeah, that's usually how it happens. So I'm just
No.
going to check and make sure everything's all right here, okay?
No,
Umbilical
it's
cord looks to
cold.
be in place. I know, I'm sorry.
No.
So that's not a concern right now. We'll continue to monitor you.
Oh my God.
Late decelerations, and these are the decelerations that we worry about. As the contraction starts to increase and gets to the peak of the contraction, that's when the heart rate will start to drop. And as the contraction decreases, the heart rate slowly begins to increase, but is still on its way back up to the baseline as the contraction is over. Late decelerations are caused by uteroplacental insufficiency. And what this means is that there's a poor transfusion between the uterus and the placenta, so the baby is not getting the oxygen that it needs.
This is a 29-year-old female. She's 37 weeks pregnant. She has type 2 diabetes, uncontrolled, with hypertension. She smokes a pack a day and abuses cocaine while pregnant.
What's going on?
Beep, beep, beep.
Oh my gosh, something's nurse, doctor.
Hi, Missy. Oh, looks like you're going into late deceleration here.
Oh no, we better lay you on your side.
Oh no, what's going
Yeah.
on? Why?
All right, stay right there.
We're gonna,
What's happening?
we need to administer oxygen to you.
Oh, okay. Is
Looks-
that for me or the baby?
You and the baby.
Okay. Oh.
I'm gonna
Doctor,
put you
can you
on
put
an
in
IV,
an
all
IV?
right? It looks like your baby's losing oxygen every time you contract, so we gotta take care of that for
Here
you.
comes
okay?
another contraction.
Oh, there it is. Yep, so we got you on that IV.
Oh, oh, oh. Okay. Oh.
Okay, you want some IV fluids right there.
We might have to prepare you for a C-section.
Oh.
Let's check out the
Oh no, that's
ultrasound.
not in my birthing plan.
Oh,
Oh, that's not okay.
this is kind of due to your history. You have
What history?
you have diabetes. You have uncontrolled hypertension.
Oh, yeah, well,
Yeah,
Yeah.
you smoke still.
no, sometimes.
Yeah, and you know
I mean, a pack a day is not a lot.
it's a lot for a baby to handle. Those
Oh,
lungs, you know.
You're fine.
Yeah. And you also have a history of using cocaine while pregnant, right?
What? No, who told you that?
You did.
You don't know what you're talking about.
You told us last night.
I don't remember.
All right.
And variable decelerations are caused by cord compression. The cord can be compressed by the baby grabbing onto it, or the umbilical cord could be in between the baby's body and the uterus. And so the maternal position can make a difference with that. Okay, so variable decelerations are called variables because they vary in shape and they can vary in where they occur in relationship to the contraction. Variable decelerations can be U-shaped, W-shaped, or V-shaped. They typically drop quickly and return to the baseline quickly.
This is a 40-year-old healthy female. She's had no complications prior or throughout pregnancy and is expecting to deliver at any minute.
Beep, beep, beep. Oh my gosh, doctor, nurse, something's happening to the baby.
Hi. Oh my gosh, it looks like your baby's heart rate is at 90 beats per minute.
No.
She's having variable deceleration.
We
What's
need to turn
that?
we need to put your knees to your chest
Oh,
right
I
away.
don't know if I can.
Knees to chest.
Oh.
All right, I'm gonna discontinue your pitocin. All right, that's
Okay.
only making it worse.
Okay.
We're gonna administer your oxygen as well.
Okay. Is that for me or the baby?
That's for you. Your baby is lacking oxygen right now.
Oh no.
Is this helping?
Oh no.
It's not helping. The heart rate's still dropping.
Okay.
She's at 80.
We need to examine the vagina.
All right, I think we need to get the baby out. I think her
Oh,
umbilical
right
cord
now?
is being pushed. Time to get that
Right
baby
now?
out of
We
here.
need to get it out. Oh, look, it's your new baby.
Veal chop is a quick mnemonic used by nurses all around to remember the correlation between each deceleration and their most common complication.